Okay, I wish to call to order this meeting if it's in the long-term care subcommittee. We have 5 bills on our agenda, 4 on the printed agenda, 1 from yesterday that has been added with the okay of the full committee chair. So let's begin with House Bill 702, healthcare facilities, nursing homes, acquisitions, and licensure. Council.
This bill requires the Maryland Healthcare Commission, when evaluating a notice of acquisition or transfer of interest of a nursing home, to provide written findings and recommendations to the Office of Healthcare Quality. The findings and recommendations must include the quality ratings of facilities currently or previously owned by the purchaser, the tax identification number of each purchaser, the Personal Centers for Medicare and Medicaid Services certification number, and a summary of the findings and the basis for the recommendations. The Secretary of Health must consider the Healthcare Commission's findings and recommendations before taking action to approve, deny, approve with conditions, or revoke a nursing home license. There are amendments that include additional quality of care metrics for the Maryland Healthcare Commission to include in its written findings and recommendations provided to the Office of Healthcare Quality when evaluating a notice of acquisition or transfer of a nursing home. The amendments as currently drafted would alter the time frame for submissions of notice of acquisition, but I understand that the parties have agreed to take that part out. And then instead of doing that, they're going to require the Healthcare Commission to conduct a study on expanding the Certificate of Need program to nursing homes and to assess the elimination of rooms with more than 2 beds, and then to also assess other nursing home issues.
So as with these revised amendments, where are the various parties of interest on this bill?
I think they're here. They should. As far as I know, everyone's okay.
APAU agrees with the amendment, sir. Thank you.
Okay, I would ask please to be recognized and to raise your hand. Is there anyone else who council thought there was more than one? Is the department or Delegate Bagnall?
Thank you, Delegate. Thank you, Chair. Could we recognize Dana Kaufman? Because I
didn't see your hand. Thank you, Dana Kaufman.
Thank you so much.
Thank you. And we worked on with the amendments yesterday, and thank you. We're good to go on behalf of Lifespan.
Okay. And can you represent, where is the department? I know you don't speak for the department.
Tracy DeShields was part of those discussions. She's been in contact with Lisa Simpson. I don't see her on the call, but they are good as well.
I just sent her an email, but as long as we take out that one section that I had left in the reprint for the 30 to 60 days, and there was another little provision right on top of it. So I will strike those in the amendments you'll vote on in full committee.
Okay. Is there comfort among the members that we have an understanding of what the amendments do and their support by the support of those amendments by the relevant parties?
I would move the amendment.
Amendments are moved and seconded. Hearing no objection, they are adopted. Motion on the bill as amended.
Move the bill as amended.
So moved.
Second.
And seconded. All those in favor of the bill as amended, please indicate by saying aye.
Aye.
Aye. Is anyone opposed? No, it is unanimous. Thank you very much. House Bill 774. Assisted living programs, unlicensed programs, resident abuse and neglect.
So this is the same bill we've discussed twice now. There are no changes to the description or the amendments, except for me to tell you that the Senate Finance Committee passed the bill with identical amendments this morning. They also added one change from what you have seen. They are going to name the program after Senator Dolores Kelly. So that would be something else for us to consider conceptually when we're considering the amendments.
Okay. Delegate Riley.
Thank you, Mr. Chair. Yeah, at the end of yesterday, I had asked a question, and I believe her last name was Ellis, Miss Ellis. She did a phenomenal job, and I did want to thank her. I don't know if she's on the call for explaining the bill. So apparently I was under the impression that the current home facilities or home nursing homes or assisted livings, whatever we're calling them, were not licensed. I mean, didn't have to be licensed, but according to her testimony when she spoke yesterday, that all the current ones that are operating should have a license. So it's something that they're operating without the license currently. I thought we were adding them to it. So that was a little bit of discrepancy that she cleared up for me. So I wanted to thank her for that very much. But going forward with this, I heard you said that the Senate just went through this, but you know, I think I still have the question that there's many of them out there that would not be able to afford the full licensing process, but yet still be able to perform, you know, great care for those elderly that are in, you know, palliative care and don't need a whole lot of, you know, other than, you know, changing their beds and such. So I was just wondering if could it possibly, I know now that the Senate is done, possibly amended that we could have, you know, the threshold a little higher than 2 beds going forward, or I don't know how everybody would feel. So that was just kind of my idea. And I do appreciate the, you know, the clarification from Miss Ellis. And so if anybody can help with that.
Ms. Kaufman.
Sure. And I'm just wanting to just give some additional information with regards to your question, Delegate Riley. There is right now, the Maryland Healthcare Commission is doing a study on the 9 beds and under. And I believe one of the areas that they are looking at is the regulatory structure.
Okay. Great. That sounds great. Thank you so much. I appreciate it.
So given that, how would this bill as it now sits, or with the amendments add to and with the amendments, how would that be affected by that study? Ms. Kaufman?
You're muted, Dana.
There you go. Sorry about that. It's separate, but that has always been one of the issues with the regulatory structure of assisted living, this one size fits all that we're operating under. But it involves a lot more discussion if we're going to separate out smaller facilities and determine then how to do the regulatory structure for them. I mean, at the same time, this is for those unregulated right now, unlicensed. So to your point, Delegate Riley, I do think it's something that needs to be looked at, but it is going to take a while to examine that and come up with recommendations as far as, yes, should they be looked at separately, and then how to do it. So unfortunately, there is no easy fix right now.
Could we add language, uncodified language, calling upon the Healthcare Commission to look at this issue as part of its study? I think
Dana said they already are looking at it. They're already doing a study on the smaller assisted living facilities, and they will be looking into that.
Okay, so that would address Delegate Riley's concern.
It should,
Correct.
yes.
Okay. So I'm sorry, Delegate Bagnall and then Delegate Lewis.
Thank you, Mr. Chair. And this is just a point of clarification, if anyone can answer. Assisted living programs, is there like a definition of services that they provide that they would be under this? Because I do understand Delegate Riley's concern, but is there a specific like set of criteria or services that they need to be providing in order to be an assisted living facility?
I'm happy to answer.
Please.
Okay. This is taxing me a little bit in my memory, but so the definition of assisted living is in the statute under subtitle 18, but it's also in the regulations. And it does list the different services, that they have to do beside, in addition to resident care, dietitian, things along those lines. So it is, I think, very well set out.
Thank you. Thank you very much, Mr. Chair.
Thank you. Delegate Lewis?
Thank you, excuse me. Thank you, Mr. Chair. My question was for Ms. Kaufman. Thank you for alerting us that there is an HSCRC study underway to ask more questions about nursing homes. When is that report going to hit the bookshelves? When could we expect it? There's so many reports every year that I've started tracking on my calendar. The release dates are the ones I'm interested in.
Yes. So the bill passed last year. It's the Maryland Healthcare Commission. And I do believe, they've had a couple different meetings. I'd have to double check because I wasn't prepared to talk about that, to be honest. But I think it's by the end of this year, but I'm happy to, as soon as we get off the call, to look at it and send you the legislation and let you know, and to the full subcommittee,
Thank you.
what the date is.
Thank you.
I can get that information for everybody for the voting session.
Thank you. Okay, so the motion is on the amendments as before us with the changes described by council.
So does that,
Well, I was going to offer the Dolores Kelly amendment next.
yes. Okay, all right.
So thank you for giving me the opportunity to say that. So the amendments have been offered. Is there any objection?
Move the amendments.
There is no objection. Okay. As a member who served with Senator Kelly when she was in the House, for one term, we were the same legislative district. It is my honor to offer the amendment naming this program after Senator Kelly and conforming the bill to the Senate bill.
Second.
Second, hearing no objection. Now we need a motion to move the bill as amended.
Move the bill.
Second.
So moved. Any further debate? All those in favor, please raise your hand, or
Aye.
aye. Is anyone opposed? It is unanimous. I'm glad we were able to work that out, Delegate Riley, and that you inquired to find out more. So thank you.
I appreciate it. Thank you. And I'm looking forward to that date on that study. So I do think it really is important, because if you read the COMAR that is under the nursing homes now and assisted livings, it's pretty intense for those homes that are doing this and treating our elderly in a small quantity. So
Okay.
thank you. Thank you, Mr. Chair, for bringing that up. And
My pleasure. My pleasure. Dana, you've
October
go ahead.
1st, 2023.
Okay. November 1st of this year. Terrific. Okay. House Bill 786, Electronic Health Networks and Electronic Medical Records, Nursing Homes, Release of Records. Council.
So this bill authorizes a nursing home that contracts with or uses an electronic health network or electronic medical record vendor to direct the vendor to release patient medical records or electronic healthcare transactions to a business associate of the nursing home. The bill requires a network or vendor releasing patient medical records or electronic healthcare transactions under the bill to make the records or transactions available on a regular basis and release the information in a timely manner to support patient care and monitoring. There are amendments that clarify that the release of records and transactions is permitted with the consent of a patient or the patient's personal representative as required under HIPAA, and prohibits the charging of a fee to a business associate contracted with the state designated health insurance exchange to improve nursing home quality unless the fee is approved by the exchange.
So these are
These
sponsor
are-
amendments.
So these, yes,
Go
these were
ahead.
amendments that I understand were the sponsor worked out. And also these are amendments that the Senate Finance Committee passed earlier today.
Mr. Castelli, can you speak to the amendment?
Yeah, and just to note as well that I think business associate has an incorrect site. I think it's 160, 103. But the two amendments basically address concerns that were raised regarding HIPAA disclosure, making sure that all of this information for the business associate was going to be protected under HIPAA and agreed to by the patient. And then the second amendment was an attempt to address concerns that were raised by another person who, another company that testified written in terms of the fee. So it's trying to narrow the fee specifically to the company that is running this program for CRISP. And this company and this program that CRISP is running really is a program that that pulls data from the medical record. Their nurses then communicate with the nurses in the nursing home to say, hey, look, you need to check on Mrs. Smith's blood pressure. So these are kind of nurse to nurse communications based on the data that are pulled from the medical records. And it's resulted in some incredible reductions in terms of hospitalizations, cost of care, things like that.
Thank you. Mr. Karshanis, if I'm pronouncing that correctly.
Hi, Chairman Rosenberg and members of the committee. Neil Karkanis here on behalf of my client. No, it's all good. On behalf of my client, Point Click Care, I just want to thank Bill Castelli for working with us on the amendments. I will say I don't think we're quite there yet, just to be clear. And I do want to thank the sponsor for meeting with us as well ahead of time. But I do have Steve Holt here with me, as well as Bill Stewart, who are from Point Click Care, who can speak to the specifics as far as why we're still concerned. Thank you.
You are recognized, Mr. Holt or Mr. Stewart.
Thank you, Chairman. Thank you, Subcommittee, for your time today, and also Delegate Zone for meeting with us. I know we've had a lot of good discussion on this to make this the best policy that we certainly can. I'm Steve Holt with Point Click Care. Who we are is really the largest technology partner to skilled nursing facilities in delivering software and technology solutions for them to be able to deliver the best care possible for the patients that reside in those facilities. And we have an office within Baltimore as well, so certainly have deep Maryland ties. And really some of the issues that we have found is that we believe this state law creates a lot of confusion as it's proposed with possible Cures Act, especially how the Cures Act in its state allows for fees and already has clear remedy structures in place that are available to be accessed by any partners, especially those that are vendors working together on behalf of the skilled nursing facilities to provide that quality care for residents. And then additionally, in the attempts to narrow the fee language, as has been discussed, we believe it leads to greater transparency issues in terms of what is allowed, what is not allowed, how decisions are made, what those decisions look like in terms of criteria for approving a fee, things around timelines and any specific processes that need to go through to effectively go through this pathway. And then lastly, what due process exists for any of these decisions that are made by the state designated entity. And really the last piece that we wanted to highlight is the complexity that this law potentially creates between federal and potential Maryland law. And I have joining me Bill Stewart, who is a leader in the regulatory space and an advisor on how we think about these things to dive a little bit deeper into that point.
Hi, everybody. Bill Stewart. I'm a senior advisor for regulatory affairs at Point Click Care. In my role, I am primarily responsible for the understanding and the implementation of regulations in regards to us as a health IT vendor. We are a certified HIT developer under the ONC definition. And therefore fall under all the requirements of Cures Act, fall under the requirements of information blocking as has been released by HHS. We as an organization have invested significant dollars over the past 3 to 4 years to bring ourselves and maintain compliance with those provisions of the CARES Act and information blocking. Those requirements are very, we believe, are clear and understood and apply to all certified HIT developers nationwide. In addition to that, we, as the largest post-acute electronic medical record vendor nationally, we are making significant investments into additional ONC certification. This is work that was essentially the federal government spent.
Let me ask you a question. Where is the area of disagreement between your client and the sponsor of the bill?
So I'm going to say that we are already addressing the interoperability requirements from a federal perspective with ONC. So ONC has very clear specifications around interoperability and the means by which you do interoperability. We are working and will be a certified API developer, which is significant definition under ONC. And by that, there is very clear ways by which all vendors, all third parties will interact with anybody within healthcare. So the disagreement is really the fact that the state of Maryland would be creating additional requirements on top of what already the federal government has already determined them to be, that we already comply with and will even further comply with as we become a certified API developer. And really, I think it creates risk, the fact that there's potentially requirements above and beyond the federal requirements that a company like ours, the best thing we can do for all nursing homes and all patients is address these things across all 50 states and the federal government, as opposed to address each state having their own individual requirements for interoperability. It's not commercially viable.
And Chairman, I would just add.
Now I'm going to call upon Mr. Castelli to respond.
Yeah, my response would simply be that, we believe the legislation along with the amendment is completely consistent with the purpose of the CARES Act, to the extent that it enhances some of the provisions under the CARES Act and some of the regulations. We think that's true, but we've narrowed it with the amendment to this particular program. And the reason is because the state has a substantial interest in the program. This is a program that's important for the state in terms of meeting its Medicaid waiver. So, this still allows the state to pay for some of this information as well. Even though I think there's a strong argument to be made that, this is medical information being taken off of the medical record and being relayed in real time directly to those nurses treating the patients. So there's probably a very good argument under the current rules that you shouldn't be paying anything more than what you've already paid, given that this is these nurses are part of the care team.
And the amendments have been adopted by the Senate committee. Is that correct? Or what?
Yes, they adopted them this morning in finance.
Okay. Mr. Holt?
Thank you, Chairman. I would just like to reiterate that Point Click Care's opinion is that this brings potential state law into conflict with federal law, where what we are talking about are two technology companies that are vendors to the skilled nursing facilities. They are not, and that is what governs those relationships. This is not a part of the individual care team delivering care. It is two technology vendors working in partnership.
Counsel, would you be comfortable drafting a letter to the AG? We're working with the two entities that are before us to try and get an answer from the AG.
I mean, that's fine, but for now, we're going to hold the bill. Is that what you're?
Yes.
Okay.
I want to act with that now, with with that help, legal assistance from the AG. Okay. That bill is moving. Okay, that we're holding that bill until we get a response from the Attorney General's office. House Bill 1060, cremations, natural organic reduction regulation.
This bill expands the definition of cremation to include the process of reducing human remains to soil through natural organic reduction. I circulated an updated set of amendments from the bill sponsor, a reprint of the bill with the amendments that authorize the Office of Cemetery Oversight and Board of Morticians and Funeral Directors to jointly adopt regulations establishing a process for regulating crematories that utilize natural organic reduction, which may include registration of crematory operators that perform natural organic reduction, permitting, operating requirements, placement of soil, and other requirements for inspection, soil testing, and oversight. And just to clarify, I actually would suggest a little bit of a tweak. The way this was worded is it said that they may establish a process. And I think it should, just to clarify, I should probably say may adopt regulations that establish a process to make clear that these would be done through regulation. So that would be in two places in the bill, just to clarify that that's done through regulation.
In the next to last line of the bill before section 2.
It does say that the regulations shall be identical to each other, but just in the lead-in language that says they may establish a process, I think it makes sense to say may adopt regulations that establish a process, because the provision that you're referencing is that regulations have to be identical to each other, but they're authorized to adopt the regulations. And then insofar as they do adopt regulations, they're required to be identical between the Office of Cemetery Oversight and the Board of Morticians. Does that make sense?
I believe so. Yes. Okay. Sponsor of the bill, Delegate Kaiser.
Thank you, Delegate Rosenberg, and thank you, Lindsay, for that fix. I don't think I have anything else to offer. I think it was a very robust debate during the hearing, and I think people had a lot of questions. And this is about, like a lot of things, we're not forcing anybody to do anything in particular, but giving people the option to do this. And it's working in other states, and it's safe. And that's all I've got. Thank you, Mr. Chair.
And it is also your view that the study, we should be proceeding with this in addition to the study in another bill that's before us.
Yes. And Delegate Boyce and I think of our bills as being complementary. And I did send an email out to all the members of the subcommittee earlier on your laptop emails addressing that question. Thank you.
Thank you. Delegate Hutchinson, followed by Delegate Cullison, and then Delegate Bhandari.
Thank you, Mr. Chair. And I concur with everything that Delegate Kaiser has been saying here. I'm very supportive of this bill. Based upon our previous discussion when we held this, I sense there was some hesitation and resistance about the bill, and I'm glad we at least resolved that the other bill and this are completely separate. I view this as an option. I view this as a choice that someone can make if that's how they want their remains to be left. I mean, there's a lot of options where you can be buried at sea, or you can become a reef out in the ocean, or you can be cremated with fire, and that has obviously some environmental impact that's there. You can have a natural burial. I understand there's religious issues that may be at play here, but again, I would say this is just a choice. It's working in other states, and I just would say I'm very supportive of this bill. Thank you, Mr. Chair.
Thank you, Delegate Hutchinson. Delegate Cullison, followed by Delegate Bhandari.
And I'm just going to say me too, Mr. Chair. Thank you very much.
Well spoken. Delegate Bhandari.
Yeah, thank you, Mr. Chair. My major concern was this is a very new one for our state, and there is not enough research. I posed the question during the hearing as well. I don't still know what happened to contamination soil and groundwater and the greenhouse gases and spread of pathogens and diseases. Therefore, I'm kind of reserved on this bill, so I can't support.
Thank you. Jamila, followed by Delegate Bagnall.
Yes, I just wanted to say, based on the information and the research that we have received, I want to remind you that, can you hear me?
Yes.
Can you hear me? I just wanted to remind you that this process is done in separate containers, so it's not going into the groundwater. And to remind you that there are exceptions to people to who can go through this process. And so based on the information that we received, I am very supportive of this. I think it would be a very healthy. I also was very pleased to learn that there are sacred ways that people's bodies can be prepared and their families participate in it. And their bodies can be prepared with like natural oils and things that are also beneficial to the environment. And so I definitely offer my support.
Thank you. Thank you, Delegate. Delegate Lewis.
Thank you, Mr. Chair. I'm going to thank the bill sponsor and just underscore that there's a separate bill introduced by Delegate Boyce that requires MDE to do a study about all the various ways that one can dispose of one's remains and to evaluate the environmental and public health impact of all of the ways. And so we can look forward to the report from that other bill, and it will help us learn more so that we, but in just underscoring that for everybody, but this is perfectly great bill and I'll be supporting it. Thank you, Mr. Chair.
Delegate Bagnall, followed by Delegate Riley.
Thank you, Mr. Chair, and Delegate Woods and I share a brain today, so I appreciate her words. But following on what Delegate Lewis said, these two bills are complementary, and that I was trying to make that point yesterday, but I didn't have Delegate Kaiser's bill in front of me, because right now the study is studying something that we're not allowed to do in the state of Maryland right now. That is why they are complementary, because the study is about people being able to make informed choices on their death care. But studying a choice that we're then not going to implement is a little bit problematic, because the study is about making those informed choices. So I'm very supportive of this bill as well as the other bill, and I appreciate the bill sponsor bringing it forward.
Thank you, Delegate. Delegate Riley.
Thank you, Mr. Chair. So on the study, we've already voted on that, and that's going forward. So the study most likely will happen. With this bill, I apologize. I actually have on my notes that I missed this hearing, so I didn't get to ask a lot of the questions or hear the answers to it. So looking at it, basically the only thing this is doing, so say the study comes back and they say this is an option that the state wants to be able to, give their, their constituents, their citizens. So you want to go ahead and make sure that the department go ahead and regulates it, comes up with the regulations and so on and so forth. Now, within this bill, are our suggestions within this bill similar to the other states that currently do this already? Is one question. And I'm sorry if this is a repeat, but I did not make the hearing.
Sponsor is recognized.
Thank you, Mr. Chairman. Yes, I mean, our bill was trying to follow the process and regulations of the other states, while certainly recognizing that we are a little different and we had to accommodate the different structures within our own laws about how we deal with funerals and burials. But it pretty much follows what the other states are doing.
Okay, and there are currently businesses or folks in our state that want to go ahead and open this type of business within their funeral homes?
More than who are on this Zoom call. There are other businesses that have expressed this interest that are already funeral owners or morticians who are interested in doing this if allowed. And I believe in at least one case, maybe two, that they do business in DC, Maryland, and Virginia and are able to do this. I think in DC. I'm waiting to see the nodding head of one of the people on the call, but no, I got that part wrong. But there are people who do business in all three areas, and they would love to be able to do this. Yes.
Okay. So how many states currently are doing this now?
I believe it's 6.
Okay. All right. So this in no way is going to make it mandatory that the current funeral homes have to offer this if we move forward. It's just an option if they want to.
It's only mandatory that members of the House of Delegates go this route. No, just thank you. I'm glad y'all laughed. No, it's not mandatory on any funeral home, cemetery, office, any of those. It's not it's not being forced on any business to do this. It's allowing any of them to have that option and then leaving it to people to have that.
Okay. If this passes, this isn't really a deal with the bill. If this passes, will we go back to the state allowing you folks to actually throw their ashes wherever they want to?
That's outside the scope of this bill. Maybe we can do a bill together next year.
All right. Thank you very much for your answers. Appreciate it.
I'm going to add, Mr. Gardner, that was the most subtle negative shake of your head that I've ever seen. You must be in the funeral business. Sorry. Delegate Bagnall, you had a question? Good for you, sir.
No, I was teasing. I said,
okay.
Is that in the uncodified language that it's mandatory for General Assembly?
Oh, okay. Well, is there a motion on the amendments?
Move the amendments.
So moved and seconded. No objection. Is there a motion on the bill as amended?
Move the
Motion
bill.
on the bill is amended.
Second.
All those in favor say aye.
Aye.
Is anyone opposed? Is anyone opposed to the bill as amended? Mr. Bondari, fine. We have one more bill, that is the House Bill 745, which we discussed yesterday.
475.
475, thank you.
475.
Thank you.
This is the bill that
I
enters
know my
Maryland
own bill numbers.
This is the bill that enters Maryland into the Advanced Practice Registered Nurse Compact. There are no
Delegate
amendments.
Cullison.
Thank you very much, Mr. Chair, and thank you very much for giving me the time to reflect, to talk to some people. I went back and read through the testimonies of everyone who came to the hearing and talked with a few people, and I think I'm now prepared to vote for the bill. I understand that there are some issues around what the compact says, some of what the compact says, but I happen to be one of those folks that believe that you can change things from the inside easier than from the outside. So, and it also gives the AP, the advanced practice nurses in Maryland who want the opportunity to participate in the compact, it gives them that option when the compact is realized. So with that, Mr. Chair, I would move the bill, move favorable on the bill.
So moved. There is a second. Is there any further discussion? If not, all those in favor of the bill, please indicate by.
Mr. Chair, I'm sorry, I couldn't raise my hand quickly enough.
Okay, Delegate Lewis.
May I be recognized, Mr. Chair?
Certainly, you are recognized.
Thank you. Delegate, Madam Vice Chair, I've gotten a lot of email in my inbox from people still opposing this bill. Could you help me and perhaps my other colleagues answer the objections that they have?
Delegate Collison, you are recognized.
Thank you, Mr. Chair. So the response is this: the compact itself provides opportunities for AP nurses here in Maryland that they don't currently have once it's realized. We don't have the opportunity now to make the changes that they would like to make, some portion of them would like to make. But if the compact becomes active because enough states have signed on to it, and Maryland becomes part of the board because that's the way the compacts work, then that's the point at which we could actually impact change in the compact. So I think this is like helping ourselves to get into a position of influence, which we don't have if we stay out of it. So I think that's where I would come from on that.
Delegate Hutchinson.
Thank you, Mr. Chair. I'm in the same boat. I'm overwhelmed with how many emails that I'm getting opposing this, and I have an equal amount that are in favor of that. But we all received an email today where it's opposing this, and in there it says that Hawaii recently held their bill this year, converting it into a study committee topic. We have just seen that the APRN compact bill in Kentucky was recently withdrawn by the sponsors this session. I have attached the Arizona and New York statements on pausing current compact legislation. Bills are not moving. I just say, well, I know this has to have 7 states in it. I'm confused on it. And is this something that can be held and we reevaluate this issue next year?
If I may say, as Delegate Cullison pointed out, the best way to have an impact on this compact, for which is optional, for if Maryland, if we move forward with a bill, Maryland joins the compact, and there are the requisite number of participants, states involved. It is the individual option of a nurse to participate. The state, the Maryland, the Nursing Association for this state, the most significant group in the state, is for the bill. And as Delegate Cullison pointed out, you are better able on the inside to make changes in the compact than you are by remaining outside of the compact, would be my view. Is there anyone else who has their hand raised? Delegate White, is your hand raised? No, okay. If there is no further discussion, is there a motion?
I think I moved it.
Okay,
Second.
I'm sorry. Thank you. All right, all those in favor of the bill, please indicate by raising your hand. 1, 2, 3, 4. Well, yeah, can you do it just so there's no,
Virtual.
Do you want to just ask how many people are opposed to it? And that might be easier. Okay.
oh, I see, well, there are now sufficient, there's 6 in favor. And who is opposed? Could you put your hand down if you're, I just want to get this right. 6 in favor and 2 opposed. Is that correct? Delegate Lewis? Just to make sure. You did not vote? or you-
I support the bill. I raised my hand. You couldn't see it.
I'm sorry. Okay, my
Thank you.
fault.
Thank you,
Okay.
Mr. Chair. I vote yes. I vote aye.
Fine. The bill passes. That concludes our work. You all are free for 11 minutes because the full committee is meeting at 2:30.
So those of you who are on insurance and pharmaceuticals, we will meet after the floor session, and then there will be a voting session after that. Thank you.
Thank you.